Everybody, it's Mary Mackenburg-Mohn, and I thought I'd give you a tour of my emergency room work site. I work in Bagley, Minnesota, where the population is 1,364 people. We're a critical access emergency room. We have 2 beds, and the house, we're attached to the hospital, of course, that has about 6 beds. So, we just walk through the emergency room doors, and this is our endoscopy room. It also doubles as our kind of our dirty utility room, because that is the only hopper we have in the entire department. There is one operating room, and it is used for storage, because there's no surgeries done here anymore. It's too small a place. In here is our entire central supply department. This is processing. Everything is hand processed by one person, and this is the entire department. And it's obviously not secure because anybody can walk through, see what's shaken. We wrap our instruments back here. We use all metal instruments still, and no disposables here. And then they autoclave themselves. One person does that. And then this is our emergency room. Emergency department, I should say. Actually, I could say room because it's all one room. This is a nurse's station with room for one person. We do have a computer system, but we do not have electronic medical records. We have one nurse at a time who actually is shared with the floor. There's only 2 nurses in the building at a time. So if you need hands for a code or a trauma, you don't have a lot of options. The only high-tech piece of equipment we really have is the it's an Omnicell. Not a Pyxis, Omnicell. So we have that. We have an outpatient procedure room, so people that need injections or blood can come in. It isn't actually used very often, and we do have one pelvic bed. That's it for that. And then this is our emergency room. Literally a room. We do have a regular crash cart and a monitor and those kinds of things that most places have. So we're not totally antiquated, but this is it for our entire emergency department. It's our procedure side, so kind of the traumas and the hearts and things like that go on this side. And then on this side of the room is where we do sutures and splinting and casting and things like that. Everything that we need is in one room, which I guess makes it kind of nice. Got a crash cart and our defibrillator. We do have a glide scope, which is a really wonderful piece of equipment. And we have a PEDS crash cart. It's here, and the only EKG machine in the whole building is housed here. We have a bear hugger. That's big high-tech stuff here. And that's it. That's our whole department. So it's a little bit challenging. 2 nurses in the house. Me. We have no respiratory therapy. We have no lab. We have no x-ray after, let's see, x-ray's here till 7, lab is here till 6. Anything after that, you do need to call them. They're supposed to be able to respond within 30 minutes. So think about that the next time you want to start lab. It's kind of laughable, if you will. Sometimes if we have advance notice, we'll call and tell them that we need them to come in. But if you don't have advance notice about what's coming in, then we can wait a long time for labs and x-rays. So that's my tour. You can think about this the next time you go back to work in your big ER and how spacious you have everything.